So we will make this recording available for people who were not able to make it. I would like to start things out with Senator Marty. And for people who aren't familiar, can you just, in a couple minutes, 3 minutes or so, just give us an understanding of what would the Minnesota Health Plan do? How would you describe it to someone who's unfamiliar?
Okay, the simplest way to describe it is it's a simple way of delivering healthcare to everyone. Same doctors, nurses, hospitals, clinics, everything else we have now, but instead of qualifying for it, you're from Minnesota, you get covered. No copays, no deductibles, and we cover everything, including dental, including all the things that aren't. You have you're not forced to choose which insurance plan you want and which network you want, because there are no insurance plans to choose, and your network is anybody who's a medical provider in Minnesota. So you make it's a lot simpler for people how to do it. It would be paid in some ways similar to what we do now. It would be premiums, but the premiums you face would be based on ability to pay, not based on how old and how sick you are, which is the way we do things, roughly speaking, now. And again, you wouldn't have to worry about a separate insurance plan for dental because it would be covered. Wouldn't need to worry about the long-term care insurance because that would be covered. Wouldn't need to worry about prescription drugs. So it's a very simple way to do it. And the reason we're doing this is basically to give better care to people, because there's so many people, especially sometimes the sicker you are, the more you have to hesitate whether you can go get care because you don't know if you can afford it. That's gone is a problem. It also makes it for people who need mental health or substance use treatment, often people who don't know they need it. And so when their family or their employer or the courts force them into it, that they don't have to shop around to find out how they're going to pay for it. It's just the pure simplicity of the system, so you can focus on your health rather than focusing on all the paperwork. And it's that's the reason we want to do this. We have healthier people, and so we don't have people falling through the cracks, which you always have when you have to qualify, because somebody doesn't qualify. That's the whole point of making it. And we think healthcare should be available to all. But some people say it'll cost more. The reality is we're getting an economic study, which I'll let Liz talk about because she's carrying the bill that is apparently being folded into the House omnibus budget bill, which is a good sign to get an economic analysis of Minnesota Health Plan versus the current system. We see what the benefits are in terms of coverage, see what the benefits are in terms of cost. And so I tell the Republicans, I think she's saying the same thing. If you think it's too expensive, well, then let us do the study. Let's have a fair comparison. Anyway, I'll quit talking about that. I think everybody on the in the legislative caucus has some things they can add about this thing as well.
Great, thank you, Senator Marty. That might be a nice transition, Representative Bolden, if you wanted to talk a little bit about what Senator Marty was referring to there.
Yeah, absolutely. And so just as he said, this is a bill that I'm carrying that did get included in the House Health, Finance and Policy Omnibus Bill, for which I'm really grateful. And essentially it's a cost benefit analysis of the Minnesota Health Plan as compared to current system. And for the very reason that was said, oftentimes one of the arguments we hear about, we can't do the, move towards the Minnesota Health Plan because it'll be too expensive. Well, let's see what the numbers say. We can't fully have that honest, full discussion right now because we don't have the, data and numbers to show that. And what we know is that when we provide care to people, when people have access to the care that they need, it is more cost effective to provide, for instance, primary care, preventative care, versus having people rely on, waiting till they are so sick, they need to seek care in the emergency department, or, whether they then end up, in ICUs and, all of those pieces. It is more cost effective to provide care that they need upfront. But having a study to show that and to be able to have that full and honest conversation. And just the last thing I'll say is not just the cost of the care, but there's other pieces that go into that we want to have included in that too. Sort of the preventative piece, also the time that and hours that people spend, individuals spend looking at what health plan do they want to choose, and also small businesses, the time that they spend looking at what plan should I choose for my employers or my employees. There's all of these other pieces that are administrative time and costs that don't provide care. They don't make care any better. It's just extra cost. So we hope to get numbers around that.
Yeah, that's really helpful. Thank you. Representative Frazier, I believe you're the lead author in the House. What is something that we should all understand about how things are proceeding in the House where we have a DFL majority? What does this look like from your side of things?
Well, I think it's not moving as quickly or as fast as we like it to in the House. It remains a popular bill, but I do think one of the stumbling blocks and the challenges, which is what Rep. Bolden and Senator Marty just spoke about, it has always been, how are we going to pay for this, or what will it cost? Will it cost more? And I think now being able to have this study and moving it forward, I'm excited. Shout out to Chair Liebling for rolling it into her omnibus bill, and shout out to Liz, to Rep. Bolden for carrying it and advocating for it to get this done. If we get this done, I believe we're going to see that there are going to be substantial savings, but also overall, I think it's going to create a more efficient and effective system for us to have healthcare in this state. And I think one of the major things for me when I talked to Senator Marty and agreed to carry the bill in the House is obviously we were seeing the disparities in the deaths and the hospitalizations due to the pandemic for those individuals but for the fact that they didn't have preventative care, they wouldn't have had some of those underlying healthcare issues that were so detrimental and so tragic for many of the folks that did not make it and who are still suffering from COVID-19. But also one of the big issues for me is that you will no longer, when we put this in place, we'll no longer have folks having to depend on their job to have healthcare. And I just think that's such an important thing to talk about, not only in terms of not having to depend on your job to have healthcare insurance, but being able to make sure that you have access regardless of what your income level is, what your socioeconomic status is. And also it's also a good thing for our small businesses. They'll be able to they won't have to depend on now individuals looking elsewhere for healthcare or having to carry that burden of healthcare to be spread out over the entire system. And I think that's going to be beneficial for everyone.
Thank you, Representative Frazier. Moving over to the Senate, with Senators Fate and McEwen. How are things different there? I mean, here you have a majority DFLers in the House. Things seem a little different and still slow. Can you talk about what some of the struggles are like in the Minnesota Senate?
Sure. You don't mind? I'll go first, Jen. Well, we are in the only divided legislature in the state, with the DFL running the House and the Republicans running the Senate. And with that, there's a lot of obstruction in the Senate. And if you think the Senate was slow moving before, well, under Republican leadership, it's a lot more slow moving, to the point where almost none of our colleagues can get a hearing on anything. And I think that having the conversations around lowering premiums through things like was mentioned earlier, like reinsurance, that's wrong. I think that's immoral, just writing big checks to insurance companies. So the only path forward that I see is for us to flip the Senate, and not just flip the Senate, but flipping the Senate with the real progressive Democrats, because I'm sorry to say, but if we only squeak by and get a 34-33 majority, that may not be enough to make this happen. We need to have a little breathing room. I'd like to see 37, 38 seats in the Senate to make it happen. But that's just my perspective, and I'll pass it to Jen.
Yeah, thanks for that. My thoughts about this is one of the reasons I'm excited about the legislative caucus that we have just formed this past year and that we're moving forward with. And the purpose that we've talked about for the caucus is really to build momentum and political power and to partner with the advocates out in community doing already the work to raise the profile of the Minnesota Health Plan and to demand it and to keep asking these questions. And like, we know we can do better than what we have right now. And we know that every one of our peer nations around the world has figured out some semblance of universal health care. We can do this, right? It's not rocket science. And so I am hopeful that as we build the momentum and as we get the study done, we have a lot of people in our coalition that are business owners that see this as the solution to being fiscally responsible, like the most fiscally responsible way to make sure that people get the healthcare that they need. And then we also protect businesses. We also protect municipalities. Locally up here in Duluth, our city council last year unanimously voted in support of the Minnesota Health Plan and asking the legislature to move forward with the Minnesota Health Plan. And Duluth is a pretty blue bastion, it's true, but we don't have uniformity across political party on our city council, even in Duluth. So it actually really said something, that it was a unanimous vote amongst our city council, because our city is really facing a financial crisis coming up here, not too far away, just because of the rising costs of healthcare. We have a bunch of firefighters that are nearing retirement and taking early retirement right now because they're worried that they're going to lose their health care going forward, and they want to lock in what they have. So all those city councilors are recognizing that this is a financial crisis looming ahead because of healthcare. So there's all these reasons, I'm probably preaching to the choir about why we want to do this. There's a myriad of reasons, but there's a lot of reasons that are in the traditionally bastion of more conservative concerns about fiscal responsibility, about taking care of business, about making sure that we're being responsible toward one another and with our money. So I think there's a lot of reasons that this should appeal across party lines. We're not there yet, but as we build that power, I am hoping that we're going to start to pick off some of our Republican colleagues who see just how common sense this is.
Well, speaking to that, growing sense of support, I'm going to share my screen here. At least that's the attempt. And if you haven't been to the website of the Minnesota Health Plan Caucus, here it is. And if you go to the members section, we have the co-chairs. But what I really want to make sure, because our co-chairs are here, what I really want to make sure that you've seen is, do you see your state senator? Do you see your state representative on this list? And if not, it would be a great idea to let them know that you attended a DFL Progressive Caucus Forum with the co-hosts or the co-sponsors of this forum, of this caucus, and you would like to see them join. So I'll leave that for you to take a look at. I'll stop sharing my screen. And maybe Greg or Barb, you could post that in the chat again so people can see it. But I just want to return back to Senator Marty. Clearly you've done an immense amount of work on spreading this idea, writing a book, sort of touring the state, speaking to people who are struggling with healthcare costs. And here's this forum, here's this caucus with all of the amazing number of co-sponsors. How are you feeling about the potential that we have here to be a state that has this system of healthcare for our citizens?
Sure, I'm excited because of the fact that, I'm one I don't describe myself as an optimist or pessimist, but a hopeful person, because there's always hope. And sometimes I've been lots of fights in the past, been told there's no way. The political experts tell you there's no way something's going to happen. And they know exactly what we have to do to win elections. They know exactly what we have to do to pass things. And they're usually wrong, but they know exactly what you have to do. And they've, I would argue, corrupted much of the Democratic Farmer Labor Party in thinking we can't really do these things because we don't have it's politically impossible. I think it's not just the DFL in Minnesota, but nationally. I think when Barack Obama was a state senator in Illinois, or a US senator in Illinois, he actually said how the only way we're going to fix the healthcare system was the universal single payer healthcare thing. And he said, but we can't get there right now because we need three things we don't have. We need a DFL, a Democratic majority in the US House and the US Senate. We need a Democrat in the White House. 5 years later, he actually had all those things, but it still wasn't politically feasible. And so he picked something, not something that made sense, which a universal, simple healthcare system like that would make sense. One you could explain to people, one that makes sense to people. Instead of picking something that makes sense to him, he just said, well, but the public would never accept that. So we got to do something that, even if it doesn't make sense to us, we got to do it because we think that's what the public wants. And that's the way the politics have always worked. If what we want is something reasonable and realistic and everything else, they attack it as being unrealistic and say, so we got to be for something that doesn't make any sense because that's all the public wants. I think the Affordable Care Act actually hurt Democrats in 3 different election cycles. I think we lost the election nationally in 2010 because of it. I think again in 2014. And I think it was actually a big part of Trump's victory in 2016. And so to me, why don't we fight for something that makes sense because we might explain it to others. The thing that I've noticed now that gives me the most hope is that a whole lot of people who were elected since Donald Trump was first elected in 2016, people were already politically active. I think all the new legislators on this call were all politically active, but Trump is elected and they see the political system going off the rails. So, hey, we better notch up our involvement a few notches. Hey, maybe I'll run for office. And there are people who don't think they were getting there to just continue the status quo or tinkering kind of improvements. They feel they're there to make change. So I really think that plus, as Cedric or somebody mentioned earlier, COVID has really changed the dynamics. I mean, it's the first time we've ever decided as a nation we're going to make some sort of healthcare totally free. Testing and COVID-related things, even the vaccines, were totally free. And we did it because we knew the importance of getting healthcare to people. And did it break the bank? Well, it's actually probably cheaper than it would have been if we did it the old way. So I think we've got evidence that it works. We've got people who believe it's time to make it happen. And frankly, we're bankrupting ourselves with the current system. So it's time to fix it.
Thank you, Senator Marty. Let me just ask one general question, and then we'll open it up to people who would like to ask a question. If you would like to ask a question, I was thinking you could type it into the chat. That might be the easiest way to do that. So if you have something that you would like to ask our representatives and senators, that would be great, and then we can kind of take them as we go. But I'm curious with Senator Marty's sort of laying out of what it would take to actually get this through and become law. Whoever feels comfortable sort of taking the question, how do you imagine things moving forward if the Senate is, as Senator Pate said, a strongly blue, progressive, and the House maintains or grows? Where do you think Governor Walz is on this? Is this something that he's been supportive of? Do we have a strong partner? This is something the DFL Progressive Caucus is, really looking for. Do we have a strong partner in the governorship for the Minnesota Health Plan? Anyone who would want to take that?
I'll take a shot at it.
Thank you very much.
I think if we get the progressive Senate that we need, and we have the progressives coming back in the House, which is important as well. I think with the way the political winds are blowing, as Senator Marty just noted, knowing that what we've done with the pandemic and how we provided healthcare during the pandemic, I just think this makes sense, and I think Governor Walz is someone that is pretty practical, and he would look at that, and in a political sense, it makes sense overall for our state and the health and the well-being of our state long term. And I think he would get there to where this would be important, and we'd have a partner to move this forward for Minnesotans.
Thank you, Representative Frazier. Any of the others speakers want to respond to that?
I'll add one thing, and that is that Peggy Flanagan at one time was a co-author of Minnesota Health Plan when she was in the House. And the governor has been kind of, he's been like his predecessor. Oh, if the bill gets to my desk, I'll sign it. Meaning I don't oppose it, but it's not going to get there unless we have somebody working for it. So I think Cedric's right. It depends. If the legislature is pushing hard, it's the kind of thing that it's kind of hard to be opposed to it if you're a Democrat and people are saying, hey, this is doable. It's, again, we have to show the momentum. And I think I wish he would be leading the charge rather than coming along with it. But I think I don't think it'll be kicking and screaming. I think it'll be coming along with it.
I'll
Thank
just
you,
add, I think
Senator
Senator McEwen mentioned this. I think this is another place where that partnership of the outside organizations and advocates, our partnership, I think that is helpful with this too, to sort of have that inside outside push and momentum to get everybody there, I think is important and useful in this space too.
Great. I see a question in the chat that sort of is a nice flow off of this. There's the question about how do you suggest having persuasive conversations with other DFLers who might not be 100% behind this? What are some of the things that you say or use to bring them to the light, to the side where we all are here? Is there a senator or representative who would like to take that?
We're all shy people. Call on somebody.
I can
Senator Fata.
I can take a stab at it. I think Jen and Liz and the team spoke very well about the business aspect of it and the human aspect of it. But one other thing that I think we can have with our colleagues in our conversations is tying it to probably the biggest issue in their minds going on right now, which is public safety. And for a very long time now, public safety and public health has been separated. And we've tried to improve public safety through punishment, penalizing people and locking them up. And that has been a failed approach. And I think that there's bipartisan consensus, not on legislation, but on some of the ideas that things like mental health, addiction are major aggravating factors when it comes to the challenges we see in public safety. But as a state, we don't seem to be caring or providing high quality care for those who are struggling. And I think that the Minnesota Health Plan would be a very good solution for this. And it's the only way that we can ensure that every Minnesotan is able to receive high quality care that they deserve. And hopefully when it's finally signed and passed into law, that we can see the far-reaching impacts from everything from racial equity, economic equity, public health, and public safety.
Thank you, Senator Fata. Anyone else wanting to speak on this before moving to another question? Senator McEwen, go ahead.
Yeah, just, I would urge people to think less about like persuasion in talking to your legislators on this topic. I would suggest having a conversation with them, hearing them voice maybe what are some of the pieces that they are concerned about with the Minnesota Health Plan. What are they worried about? What do they think is not there? I feel like it's just a question of moving the needle of power or a perception of power. So my sense would be, instead of trying to get in there in an office and persuade a legislator, you want to find out sort of what are their sweet spots, what are their prized constituencies, and you want to go talk to those people. So I would probably, if it was in a more conservative district, find out who are those constituents that legislator really counts on and really values what they have to say, and then persuade them. That might be small business owners. That is key, I think. Small business owners, healthcare professionals who are on board with this, and just start building those networks locally. And then that push and that talk will have an effect. I like politicians, the majority of politicians are going to respond to a perceived push and a perceived movement amongst their constituency, amongst the business community, like that this is a demand that they need, that they are wanting action on this. And I think the majority of politicians will respond better to that than they would to you in their office trying to have a heart to heart. Not to say you shouldn't do that too, but I think if you're trying to maximize effect, I would work the networks.
Excellent. I see someone with a hand, and I think that you've tried before to get in, so I'm just going to help you out here. I think it looks like it's Anne. And I will try to unmute you here, Anne, so that you can ask a question. So you should see on your screen a spot that will allow you to unmute. There you go.
Actually, Rich, I wondered if I could share a couple things. So I'm real active with Healthcare for All Minnesota. I put a program that we have coming up on Thursday evening in the chat for people to register. It's called Keeping Americans Sick and Poor, How Big Money Sabotages Healthcare Finance Reform. So it's my strong belief that our three biggest barriers to fixing this are ideological barriers, big money, the big money that's arrayed against us, and fear of change. And even though the current system is bad, people are afraid of a big change in something that's kind of personal as far as their healthcare coverage goes. So anyway, got that program on Thursday. I'm sorry that it's on Holy Thursday. We didn't realize we do something every second Thursday, and it just turned out that it's Holy Thursday this week. And then if you can allow me to share my screen, I can show you something that the health department just put out. I'll give Dave Garibaldi credit for sending it out. And it's a graph that shows if we do nothing, this is what happens to health spending in Minnesota.
Could you possibly, Anne, put that in the chat so that people could pull it up on their own screen? Just
I don't know. It's a slide.
Oh, okay.
It's a slide. You can go to the Minnesota Department of Health website and see it's from I might be able to put a link to it. It's from
Great.
a publication that they did on the cost of health spending in 2018, 2019. But this graph is shows what if we do nothing, the cost of healthcare goes straight up. I don't know if you can allow me to share screen.
You know,
it's
I'm
disabled
looking
right
for
now.
it. Yeah, I'm looking for it on the
Okay.
tools here, and I'm
If
not.
you can find me, you might be able to. Anyway, what it shows is that the cost doubles over the next 10 years if we do nothing. So, but what I'd like to say is something that Senator Marty often says, saving money is important, but it's not our main goal needs to be to get everybody covered. Our main goal is to take care of our people. And I think we all want to lead with it'll save money because it probably will. And, you know, if we get a new cost study that will update, the old one is 10 years old now. But I still think we should talk more about we want to take care of everybody. That's really our goal. And in the process of doing that, if we create a better system, we believe we can save money as well.
Thank you, Anne. Any senators and representatives want to respond to that? Sounded like somebody was starting.
Anyway, I put the link for the program on Thursday in the chat, and you can register for that. It's also on our website, hca-mn.org. Okay,
Great.
thanks,
Yes.
Rich.
Yes, thank you. Also, before I forget, there was this great question really early in the chat that I would like to hear from the representatives and senators here. Greg Layden had written at the top, and this is always nice, like, later this evening, I'll be sending the Indivisible Minnesota Legislative Action newsletter to about 8,000 activists. What do leaders here want to ask them to do this week to help advance your project in the legislature? And he says maybe even be specific and type something in the chat. But I think that's an opportunity we don't want to miss out on. We have the ability to reach 8,000 people this week. What would you all like to see happen, representatives and senators? Maybe Liz, would you like to go?
Yeah, I mean, I'll just chime in to say the first thing that comes to my mind is making sure that the study gets across the finish line. So as we have talked about, that's going to be in our House HHS omnibus bill. So we'll pass it out of the House. But, as we know, divided legislature, conference committee, there's going to be negotiations. And so advocating for that to get across the finish line, I think is an important piece right now.
I'll add to that related to that, not just contacting the House to put it in there, but also contacting the governor to push for it as well. And wouldn't hurt to contact Senate HHS committee members as well on that.
And I saw a post there in the chat from Senator Fate as well. Senator McEwen or Representative Frazier, anything you'd really like to see people doing now, and actions you'd like to see people taking?
I think being vocal and being visible about this, about why we need it, why you want to see it, why it's important. I think going back to what Ann said, it should be, and Senator Marty has said as well, it should be about the care that we're providing for people. And I think in Minnesota, we always talk about how the most important thing is not about the dollar bottom line, but it's about taking care of each and every Minnesotan and making sure we're doing what's best for them. And that is what we should lead with. And I just think at the end of the day, everything else will work itself out. I think someone mentioned, I don't know, Senator McEwen, you may have said that, it's going to lead to more productive and a healthy state. Someone said that, and that's going to save money. You're not going to have people using the emergency room as their primary healthcare provider. That's going to save money, and it's going to be enhanced the livability in the state of Minnesota.
Yeah, I agree with all of that. I mean, the idea that we should be leading with the real human aspect of what we're trying to do here to provide care for one another in community and make sure people can access healthcare. I completely agree with that. I just want to be clear, we've been focusing on the financial stuff a lot because that's sort of a hook that we want to work on a little bit with some stakeholders. But I agree completely that this is all about making sure that we care for one another in community, and trying to address the great cruelty that is our healthcare system right now. Yeah, one of the things that I try to encourage people to, like, if we have this forum to say, hey, please do this, like, in addition to, getting this study done, I also don't want people to sort of automatically assume that our Republican legislators are not going to come around. I want people to go to them and demand this from them, that we deserve at the very least a study to find out what it's going to look like, and then they want these people to be working on this. So I don't think we let Republicans off the hook. I think we ask people to move on this regardless of party. This shouldn't be like, I really want to see this move past this sense that this is somehow some lefty fever dream that we have. It's not. I mean, it's really shouldn't be a partisan thing. It shouldn't be a left-right thing. There's so many reasons to do this, and so I want to hit all of them,
And the other thing is, when we're talking with people and when people are contacting legislators, including, as Jen said, Republican ones, we just say, what about people who can't afford health care? What about people who can't afford the deductibles or dental care or other things? Because there is no other proposal in either house, and I don't think there ever has been in Minnesota, to cover everyone for all their medical needs. No other one that gets rid of the networks, no one other one that's affordable to everyone. So again, it's the whole thing. If they're ideologically opposed to this for some reason, tell them, where's your plan? Come up, we need a plan that's going to cover everyone, because they don't have one.
Thank you. So again, if you have a question or a comment that you want to have addressed by our panel, feel free to just type it into the chat here. And this could be a little more free flowing. I think it was great when Ann had the opportunity to speak. If we have other people here on the meeting who are active in an organization revolving around healthcare and would like to speak to the group, we can do that as well. You can use the raise hand function there, and I can unmute you, and that might be even a better way to go about things. But one thing I'll ask while we're waiting to see if there are other questions, I think one advantage that we have when we have these representatives and senators here with us is you've spent a lot of time talking with your constituents, hearing stories, understanding people's struggles with healthcare. And I think the more that we share those stories, the more that people can have deeper and more meaningful conversations when they're with their coworkers, when they're with their family. Why do we need this plan? I have health insurance, or I've been healthy, or whatever their sort of counter is. Are there particular moments, particular stories that you've heard with your constituents, people who have reached out to you about this, that you find compelling and like drive you, that stick with you, those stories that kind of keep you going and fighting for this healthcare plan. John Marty, do you want to start with that, or does anyone else?
I don't mind, but I think that a lot of these questions are related to that. But I mean, I think we all have lots of those stories, and I don't care. I can speak to them. I just see like 4 hands all of a sudden.
I just saw that as well. Well, let's maybe just go that direction then. And we can always, return to that. So I'm gonna unmute Lawrence. You should be able to speak there, Lawrence.
Yeah. Yeah, a question. Oh, I hit that twice. Okay. A question I have is these increasing health costs. Is that because of increasing sort of per unit costs, or, as I suspect, because the population is aging and you have more people getting more services? Unfortunately, I think I've done that. And I'm lucky enough to have good healthcare or good insurance and everything else. I'm not worried about it. But many other people, these kinds of bills would be crazy if you had to pay for it yourself, or if you didn't know whether or not you were covered, which is often the case. But the main point is, as people get older, they will have higher healthcare costs almost always. And that may be driving this, but we need to get that under control. At the time, boomers are aging out, I guess, but not so much to help them, but to protect everyone else from the outrageous costs here. If we can, this is a good time to lower costs for the next generation to get things under control.
I'll comment on that quickly, since you had asked me, Rich, earlier. 2 things. One, yes, obviously aging population drives healthcare costs. People say, oh, we've got more obesity in our country. Well, we do. We have less smokers than some other countries. We have all kinds of mixes of things, but none of that explains why we're twice as expensive as anyone else. And
Yeah.
I think there are only 8 countries that spend more than half what we spend per person. And the health outcomes are
Yeah.
far from ideal here. So I think the thing is that, yes, one of the reasons for saving money is because we're bankrupting ourselves on it. It's our part of our GDP. We're almost double what a lot of countries are on it, even though our GDP is higher. We're still way above it. So bringing down the cost through logical system, and Liz's bill is one that not only says we're going to calculate what we're spending now, but also calculate things we don't count. The time you spend filling out all your insurance paperwork, your co-pays, deductibles, all the other stuff you have to do, and all the stuff employers spend, none of that's actually counted now. We don't count that in. We count the administrative costs of the health plans and the medical providers. And so to me, taking that out and the price negotiation, if every provider had, say, 25% less cost because of less administrative stuff, you could cut everybody's rates by 25% and they'd all be just as well off. Some providers might need more, like mental health, because there's a shortage of them. We need to encourage more people to get in there, but others would be savings, because some places charge 10, 15 times as much as others for the same thing. So it's just the illogical system. It's not one thing. It's just the entire system is so gummed up that we have to do this, because medical inflation continues, not just because of demographics, but it continues to grow far faster than inflation. And I don't think none of us are pretending we're going to be down to the cost in Great Britain or Canada or other places. We're not pretending we're going to drop by 50%, but we think we can do it for less than we're doing. And in time, it goes down further. The US government currently spends about as much on healthcare for every one of us as the British government spends for everybody there. But in England, that covers virtually 100% of the cost. Here it covers about half.
Thank you, Senator Marty. I had a request here from Mike Maleska. He had typed a question in really early in the meeting, and he doesn't have a microphone. And so he's asked if someone could read the question. So he had typed in. So Mike, I don't know if you can hear me all right, but what I'm seeing here, great, okay. says from Barb in Robbinsdale, the hospital system where I work lost 33 million last year. I'm assuming all of them are in a similar condition due to COVID. Is there any further aid in the works to prevent loss of service or closing of hospitals? Anyone have an answer for that?
If Liz wants to, I'll let her go first, but otherwise I'll say that I feel sorry for some of the hospitals. I also know that when every one of the hospital systems in Minnesota seems to be paying their CEOs $1 million plus salaries, sometimes multiple millions, they're not hurting too much. Every time there's a recession, every time there's something else, where are the big cranes in the Twin Cities and elsewhere? They're around the hospitals, building more and bigger and more fancy places. So I don't think we should overstate the problems with the system. I think that there are a lot of inequities there and so on. The bottom line is federal government and state government have put in a lot of money because of COVID. And I would say it's not across the board that they're hurting because of COVID, because of the other things they've been stepped up to do. And a lot of the rural hospitals, I think Alita had put in a comment earlier about rural healthcare access and how many rural hospitals are closing. And most of them, it's not because we're not spending enough money for them. It's because it's based on business decisions of the health plans, Essentia, Mayo, people we used to think were the good guys in the white hats who are trying to make things better for everything. They're making business decisions not based on medical need. And putting more money into it right now, it's what we've been doing in the past and we'll probably continue to, but the smart thing to do would be to make sure we have a logical system and that hospitals in rural communities are kept open because they're needed, not closed because somebody else's corporate business decision. And I think Liz or Jen or others can give a lot better perspective on what they're seeing in rural communities where hospitals are closing.
Representative Bolden, do you want to chime in?
I mean, I would just add, and then I'll turn to Senator McEwen as well. I think, the system we have now isn't logical and doesn't make sense. And as was said, is based on business decisions, oftentimes at giant corporate profits. And so, we have communities where there are multiple surgical centers, across the street from each other, just a block away from each other. And then there's other areas where there's not a mental health care provider for, miles and miles and miles. And so that doesn't make sense. And so with our plan, being able to have negotiations and making decisions and incentives to get care where people need it, and the types of care where people need it, it allows for more of a logical system based on the need of the population, not profits for corporations.
Yeah, the only thing that I would really add to that, I agree. It's really about that this lack of adequate healthcare in rural areas and the consolidation of our hospitals into these big behemoths in larger metropolitan centers, closing off smaller service centers, availability of different kinds of care. And we've heard recently, if someone has a high risk pregnancy up in Grand Marais, they have to drive all the way down to Duluth to get service for their pregnancy, like to see the doctor and to deliver their child. So it's just totally unacceptable that they don't have that basic healthcare to help them deliver a baby up in Grand Marais. So I think it just, what it really speaks to is that there are certain areas of our lives where having profit motive be the leading factor of how it's all going to shake out and how it's going to work out just does not serve us well, right? There are some areas of life where the profit motive works just fine and it's great, but healthcare is not an area of our lives that should be dominated by profit making. That's just what it comes down to. You end up like with exactly this.
Thank you, Senator McEwen. And thank you, Senator Marty, for working in Alita Baroud's questions about the rural. That was going to be the next one I was going to go with. But now I want to return to some of the hands that are up because they put up their hands. They're wondering why I'm not being called on. Ken Engelhardt, I see that your hand is up, and I am attempting here to unmute you. Give me just a moment. There you go. That should work.
Yeah, thank you. I'd like to just talk about a few things that have been raised in the chat. The first one was a question about unions and why aren't we getting unions on board? By the way, I'm co-lead of the Health Justice Allies along with Rose Roach as part of Healthcare for All Minnesota. So we actually do have unions as part of our Health Justice Allies Coalition. We have the Minnesota State Retiree Council, AFL-CIO, Education Minnesota, Minnesota Association of Professional Employees, Minnesota Nurses Association, SEIU Healthcare Minnesota, and SEIU Local 284. And just a couple days ago, the Minnesota State College faculty voted to endorse single payer and the Minnesota Health Plan. And we're looking to add more unions and more other organizations to join our Health Justice Allies. Second comment about unions is about not wanting to give up their plans. Keep in mind that in 2019, when GM went on strike, on day 2 of the strike, GM took away healthcare benefits from the employees. And the recent Minnesota teachers strike, there was a big concern come April 1st, if that strike was still ongoing, whether the teachers would still be able to have their insurance. And the answer to that would be actually no, they'd have to go to COBRA. My wife was part of that. She's a nurse in the school system and actually helped answer questions for the teachers and other staff about what was going to happen to their health insurance. So the second thing is rural hospitals. Now, part of the reason why rural hospitals are struggling and other hospitals are struggling is the way we're structured. United Health Group in the second quarter of 2020, at the peak of the pandemic, made a record profit that was double the second quarter profit the year before. And what did they do with all that money? Did they help the hospitals? No, they kept that money. So it's a flaw in our system. And under Medicare for All and the Minnesota Health Plan, hospitals are on a budget. So they know they can rely on money coming to them to stay open and serve their people. And then the last thing I'd like to say is we would like to help the Minnesota Health Plan caucus as you go about your statewide tour and town halls and things that have been talked about. We would really like to help promote your events. So if you could just let us know where you'll be going, give us plenty of advance notice. We're going to be working with local chapters and things like that to assure a good outcome and a good attendance. So yeah, just let us work with you on that. We'd love to help out with attendance and promotion. Thank you.
Thank you. I believe I just got a word here that Senator Fate is going to have to step off soon here. So thank you very much for being here with us, Senator Fate. And are there any last words that you would want to share before going?
Yeah, thank you so much for allowing us to engage like this. This is very energizing and exciting. And I'm really optimistic about what we can get accomplished next year. I think that a lot of all of my colleagues spoke very well about why we need this to happen and how we can get it done. And the conversations we're having within our district. And I know that within my district, speaking with folks, it's the same as what we're seeing statewide, that the major concern with our system is the rising cost of healthcare, as well as their prescription drugs. Those are the two major issues. And many folks within my district are also living without health insurance. And I live and represent a district that's has a high population of BIPOC folks. I have the largest community housing for Native Americans in Little Earth. We have a high population of Black and Latinos, and a lot of those folks that are also frontline workers too, that have been helping us throughout this whole pandemic. And we've seen folks that either have no insurance or folks that do have insurance but still cannot afford their medical bills because of co-payments, deductibles, and high premiums. So I'm really optimistic that we can finally change the lives of these folks for the better with the MHP and with this caucus and with your support also. So thank you so much.
Thank you, Senator. And Ken, thank you for your remarks earlier too. I really appreciate that. And Senator Marty made a nice additional post in the chat. I have one other question that I wanted to read for someone who doesn't have a microphone, and they had asked this earlier on and then aren't able to get it in. This is a question from the treasurer of the CFL Progressive Caucus. Federal aid seems to be targeted for certain healthcare plans. Would Minnesota get waivers to get the same amount of federal aid? Does anyone feel comfortable trying to address that question? Yeah, that's a difficult one. And if I see a hand, I can unmute, but while we're waiting on that one, let me go to Steve, who's had his hand up for a while. Trying to unmute you here, Steve. You should be able to go now. Do you see on your screen there, Steve? It should say click here to unmute.
Am I supposed to speak, Rich, or Steve?
Oh, I'm sorry, Riley. I clicked just the wrong button.
Okay, I was so confused.
Sorry. Steve, give me just a moment here, and then Riley, I'll get to you next. Okay, Steve, there you go. That should do it.
Okay, yeah, yes, I'm kind of echoing some of what Ken Engelhardt was talking about. But when my wife and I first got involved with HCAM, or with its predecessor back in 2008, there was a campaign for the Minnesota Health Plan that went out to various regions of the state, actually. And I think Senator Marty was part of that. And I'm wondering if the healthcare caucus would be amenable to doing something similar to that once this session is over this year. Because I think it really, having them go out to various, and probably more into the rural communities, would be really helpful to help educate people on the benefits and all of what can come with that Minnesota Health Plan. So that's a question.
Yeah, I'll start and then welcome others to join in. I think that's a great point, and absolutely something that we have been talking about and plan to do after session, is to sort of have a bit of a road show and to be able to connect with people across the state, because I think it is something that sort of, once people hear and learn more about it, if they're not familiar with it, many people can quickly get behind it. And so just, answering those questions and raising people's awareness who might not already be familiar with it is absolutely on the plan. And thanks for raising that. And in partnership with, again, the allied organizations who have been doing this work and pushing for this, leveraging those relationships and partnering with them as well is really important.
Thank you, because that really is what got us motivated. We went to one day, they came to Northfield where we live, and that got it started. Yep. So that would be great. Thank you.
That's great. Thanks for bringing that up. That is definitely one of the things that our caucus has on the front burner, is that we're going to be doing these barnstorming sessions around the state, and having sort of forum/rallies of supporters, and just really trying to press events and raising the profile, and as Representative Bolton said, answering people's questions, and also hopefully bringing local leadership that people know locally who are in support, so they can see them voicing support and their reasons why too. So, yeah, it made a difference in Duluth too for a lot of activists to have Senator Marty and different advocates come here locally to talk about why this was so important, and it really generated a lot of enthusiasm.
Yeah, I think that's very important, and I'm looking forward to doing it. I think it gets to what Senator McEwen said earlier about not persuading the electeds, but persuading the individuals that can persuade the electeds, and having those direct conversations will absolutely do that.
Thank you, Representative Frazier. All right, Riley, I'm sorry earlier for the mistake. I will now unmute you.
Hi, Riley Schumacher, he, him, upper, I guess mostly down for some people at least, in St. Cloud. My question was curious. I see most policy issues not always being around the policy themselves, but the funding to enact the policy. So what is any of the representatives' thoughts on a possibility of using a legacy-like amendment structure to fund healthcare and give access to it, all that funding to all people or all residents of the state? And obviously that is a very aspirational, but it was done with the legacy amendment, great. And I worry about all of the hospitals closing and losing all that public infrastructure from the lack of investment during COVID to nothing, to just empty warehouses and hospitals. And I worry about that lack of capacity next COVID or any other illness we might get. So what do you think of investing legacy on a more infrastructure, but also of course, healthcare based emphasis to retain that lost resources?
Are you wanting in there, Jen? Oh, John, okay. There you go, John.
Okay,
Oh, try that again.
there, I'm unmuted there. The question about legacy, you were asking about how would something like that. Well, bottom line is some of these hospitals do need more money. There are a lot of things, mental health programs that need more money. We have to do that. The issue is, how do we make sure that we have a sustainable funding source for this? And to me, I think the main thing we have to do is make sure, one, it's reliable, and number two, that everybody's paying into it. Low income people, the sickest people often tend to be the lowest income. They can't afford it. So we have to have a premium structure. It has to be based on income, based on not just earned income, but all income. So it's truly a progressive system of doing it. Then you're not going to have that same sort of problem. Again, over half of the funding of our current healthcare systems coming from state and federal government. We'd be continuing to take that source, but we would be doing a business tax for businesses, and for individuals, it'd be premiums. So yes, we need, the trouble is, it's hard to say, well, we got to put more money in to help these rural hospitals. We have to put money in a way that's going to get there. If we increase money to Mayo or Essentia or other hospital systems, Sanford, does that mean those hospitals are going to stay open? No, we can pay them more and they suck it up in other ways. We want to make sure that we're negotiating with hospitals and giving them the need they have. We do not want to lose that infrastructure. That's why I'd argue it's urgent to do this quicker rather than later. But I don't think that should be a big problem. The main thing is what we do until we get a single payer system. What do we do to keep the hospitals open now? And solution has generally been, when we're desperate enough, we just put more money in. And that's one of the reasons we have such an expensive system, and people seem to skim off the top of it every time. So, and I also, had to mute for a minute, and I missed the question that Rich said was about federal aid seems to be targeted for certain health plans. Would Minnesota get waivers to get the same amount of federal aid? That's what we'd be asking for. We have two fights here. I don't mean to make it sound worse, but we have to pass Minnesota health plan. And then number two, we got to get several federal permission, either change of federal law or several waivers on how to do things. And we basically want our share of the money, not more, not less. I mean, we take more, but nobody's going to give it to us. We're just saying all the money that they're spending for Medicaid, Medicare, VA, everything else, we want them either to keep funding those same things or to give us some money from it. It would make more sense for them to give us some money for it. But supposing with Medicare, they're not going to, supposing they say, well, we're not going to turn over Medicare to you, then, well, if you're over 65, you'd be covered by Medicare, and we just fill in the gaps. We deal with the co-payments, we deal with the dental, we deal with the long-term care, we deal with everything else that they don't cover. But bottom line is, we're trying to get the federal, we want to maximize the federal dollars we get. And that's why it would take a lot of negotiations and some waivers from the federal government.
Thank you very much, Senator Marty. That's really helpful. I see we have two questions in the queue here from Anne and Lawrence, who have both had a moment to ask a question. And I will go to you both in a moment, but I just wanted to, ask, is there anyone who hasn't had a chance to speak and you've been waiting to, and you're thinking, oh, I'm not gonna be able to go because there are two people left and we only have 20 minutes. Is there anybody who was eagerly sitting on a question? You can raise your actual hand or your Zoom hand, and I will let you jump the line. While we're waiting for that, I would like to give a special thank you to Fabian Bean, who helped organize the schedules of all of these representatives and senators to try to get them here for this forum, and for all of you in the DFL Progressive Caucus who helped get people to come to this event. This has been really great, and Fabian, thank you for the hard work that goes into trying to wrangle all of those schedules and for the work that you've done. And seeing no other questions, I'm going to go ahead and allow Anne to ask a second question. And you should be able to be unmuted there.
Well, actually, I want to offer to answer a question.
Oh, great. Even better.
So I see that Alan asked one of my favorite questions in the chat. And I know there's a whole bunch of stuff after that. He said, how do you talk up to the people who are employed in the insurance industry and would lose their jobs and is their job retraining? What I wanted to say is, yes, we have a good answer for that. And it's actually such a good news story that we should learn to answer that question. We would create more jobs than we would lose. And we have some actual numbers to that. The 2014 Lewin Group study, 2012, 2014, actually quantified the number of jobs lost in Minnesota, about 42,800. And this is in Senator Marty's book. So kind of my point is to send you to the resources that we have. We have a ton of resources for people to learn more about this. And the more you know, the more you can defend and talk about this issue with your friends, family, coworkers, neighbors. We would, as Senator Marty points out, that number is 1/3 of the number of people who turn over jobs in 1 month in Minnesota. Now, of course, we've had a COVID-19 pandemic in the middle of this whole discussion, but we're still back at really high job creation numbers. And we understand that if we take care of more people, we're going to need more healthcare workers. If we take the burden off small businesses can expand and grow. And they've told us that. And we're going to need, we are actually going to need, this will create jobs. We will not lose jobs. And yes, there is job training and transition, 2 years worth at least in the Minnesota Health Plan. And also there's two different things. There's a Minnesota Health Plan, it's a state-based program. There's a national health program, which is Medicare for All. So not to be confused. We all support Medicare for All, a national health program, but we're really specifically talking about the Minnesota Health Plan here. So then I want to point you to, there's a toolkit on our website, hca-mn.org. We've got a frequently asked questions in the toolkit that comes right out of Senator Marty's book. And then there's Senator Marty's, the mnhealthplan.org. I think that's right, Senator Marty. There's a huge FAQs on that website. I mean, you can scroll through anything you ever want to know. So I say, read the book, read the bills, come to some of our classes, and then help us push this, because our job is to create demand and put some wind at the back of our legislators who are going to take this up at the legislature. I think that's my pitch.
That was really helpful. Thank you so much.
Okay.
Any of our panelists want to chime in on that or respond in terms of what Anne was sharing?
Thank you. Great resources, and thanks for all your work.
All right, then let's take a question here from Lawrence. You should be able to unmute there.
More of a comment than a question. This seems to be building momentum over the years. I used to be in Senator Marty's whole district, and I've heard him talk about this for a while, quite a while, and other people along the way. But it's places, we're getting older as a population, and healthcare costs are going up, and this seems like the perfect issue for rural areas. Maybe this is a time to take the rural areas back to the Democrats with healthcare. I mean, who's gonna fight against a long and happy life, right? What's your counter to that?
Can I comment on that? Because I think you're exactly right about somebody had, maybe it was you had a comment in there. Could this be an issue to help turn back rural? Could this be a silver bullet? I don't know. Anything's a silver bullet to turning people back from Trump voters to Democrats in rural communities. But I think the opposite of this is what caused that transfer. In 2016, Bernie Sanders was doing wonderfully well on the Iron Range and a lot of other places, pushing single payer. He got beat, and all of a sudden we were hearing premiums going up 50% on the individual market, and people got scared, and Donald Trump filled them with lies about how he's going to make it better, and they bought it. And they don't hear our stuff because they listen to right-wing media for their only source of news. But I'm convinced in rural communities, when we first started, when Steve Janis was talking about how when we first organized, had these tours around greater Minnesota, we had the best response in greater Minnesota because people's healthcare is hurting more out there. I think this absolutely could be the kind of issue that would turn over greater Minnesota communities again. And the only way it's going to happen is if we talk about it. But instead, in the political world, all these political experts who tell us they know exactly how to win elections, they tell us you can't talk about something controversial like this because it's going to hurt us in those rural districts or the swing districts. Frankly, I think it's the only thing that's going to give us a chance to win them.
Yes, yes, yeah. And John, you mentioned one fact that is always compelling, that among the wealthy countries, we spend about twice as much on healthcare. The other part of that message should be, and I'm sure you know this too, but that we also have the lowest life expectancy among those same countries. We're on par with Costa Rica on life expectancy.
And we're slightly above Mexico and others on infant mortality and other things like that, but we're way behind everyone else. Yeah, the international health statistics show, because we really do have some of the best medical professionals in the world. Absolutely have some of the best hospitals, some of the best clinics, some of the best doctors, nurses, everything. We just have such a cruddy system for getting people access that we have terrible outcomes.
Mm-hmm. By the way, I didn't mean to slam Costa Rica. I love Costa Rica. I've been there a number of times, but their per capita income is about what we spend on medical care alone.
Thank you, Lawrence. I'm going to try to get Riley in here too before we're out of time. We're in the last about 10 minutes here. Here you go, Riley.
I had a more slightly current but also past question. I know dental coverage had expanded for under Medicaid in the state program, and a large amount of funding was passed last year around that I think it was around the summer. However, if I recall, only a month or two ago, the federal waiver had yet to still be approved to enact that funding, because I was talking to my healthcare and my insurer was still saying they weren't allowing any of those to be covered until the federal waiver was approved. And until that's approved, they weren't going to say they were getting any access to those periodontal funds. So is there any update on the federal waiver being approved after a year?
I'm guessing it has been, but I haven't heard yet. So check with your provider again.
Thanks for that question, Riley. With the last 10 minutes left here, I did include, again, a couple links in the chat if you are noticing the list of our legislators who have joined the Minnesota Health Plan Caucus. And then Ann listed her great links there as well. And then I have listed the ability to join the DFL Progressive Caucus if that's something that you're interested in doing. We are looking to grow our numbers there, and feel free to share that with others. But in the last 10 minutes that we have here, I would like to give an opportunity for our representatives and senators to just share with us a bit anything that you wanted to leave us with, something that we could be aware of. And I think it's always good to have an ask. So one ask is that if you do not see that your representative has joined the Minnesota Health Plan Caucus, please write them, tell them you attended this event, you met the chairs of the caucus, you're compelled and want to see more people join the caucus. But let's start out. You all can sort of negotiate who goes next here. I'll just leave it open to you.
Okay, I'll jump in.
Thank you.
So the thing I would leave people with is, again, just a thank you for spending part of your Monday evening with us. This has been a really good conversation, and I'm really grateful for everybody's work on this. And it has been years and years of work for many of you on this call. So thank you for that. Just to underscore a couple of things that stand out for me. One is, it will take all of us to move this forward. And I really do feel like there is momentum and that we are moving in the right direction. And so that partnership of that inside and outside is really, really important. And I think is the thing that is going to eventually make this happen. And so having those conversations with, as was said, people, your reps and senators, whether they are on that list or not, if they are, tell them thank you. If they're not, ask them why not. And then the other thing I think is just to continue to elevate this issue. And we talked just a little bit about stories. And I think that is a really powerful way to sort of illustrate the need for this. And, there are absolutely stories that stick in my mind. Honestly, the stories that stick with me the most are the stories from my time as a bedside nurse and the patients I took care of who were there because they did not have access to healthcare until they were in my ICU bed. And so elevating those stories of why this is needed, I think is really, really important, just to continue to make the case. And, just focusing around the care that, everyone deserves to have the care that they need. And we can do that. It's a choice. We have the resources, we have the ability, we have the plan, we can do that, and we should. And so just continuing to push for that. So thank you very much.
Thank you very much.
I'm happy to jump in. I actually thought of one more thing that I wanted to bring up that I should have brought up earlier when about the ask of, so it ties in well. But one of the things that I experienced, if you're not aware, a lot of us doing this work right now are new legislators. We just came in, all of us together, except for our dear colleague, Senator Marty, who's been working on this for so long. But a lot of us just came in to the legislature, and I hope that the energy that we're bringing in and sort of this hopefulness of what we could do together will continue, so that this next class of legislators that is going to come in fresh this next year is also going to be a class of candidates who are ready to not just like sign on their name to a caucus. That's great. That's a good start. It's a good step. But I want people to ask candidates running for office in your districts, running for House, running for Senate. I want you to go to their events or meet with them when you have an opportunity and ask them, do you support the Minnesota Health Plan? And then if they say yes, then the follow-up, the next step is, what are you going to do to see that enacted into law? Because we need it, right? So I say that because of a couple of reasons. My predecessor in the Senate, somebody who I challenged in a primary and then I'm now in the Senate, he also supported the Minnesota Health Plan, which was great. But I think that one of the issues that I ran on and I think resonated with a lot of people in my district is, well, what are you going to do about it? Are you going to get to the legislature and just sort of sign off and have it be a sort of progressive credential that you can sort of show your progressive card and say that, oh yeah, in theory, I would support this if it ever was going to go anywhere, but I'm not going to lift a finger to actually make it happen? Or are you going to go to the legislature and get involved in the caucus and really put the pressure on your colleagues and really move your allies and talk about how this is going to move? So that's what we need. We need more champions for this, not just people who are going to just say, okay, sure, in theory, I would support this, but people are going to get to the legislature, make it a top priority and make it happen. And so there's that. And then the other ask I have of everybody is that I'd also think it will really help if you bring this issue to various institutions that you're involved in. So whether that be your labor union that you're affiliated with, or that you talk to your colleagues, talk to people at work, talk to people in different organizations that you may be involved in. The Farmers Union would be a great one to really do this work, because candidates for office sometimes get the message that the progressive angle that they need to jump in on and support is the public option buy-in, right? That's the message that I was getting in a lot of more institutional settings. I would go to forums and people would ask me, and this still happens, do you support the public option? And my answer was always like, sure, yeah, but what about the Minnesota Health Plan? Why are we going for what we really want and we really need? And then so I was sort of making the pitch for the Minnesota Health Plan when I was running. But that was what a lot of people, my constituents, in part because of having heard Senator Marty and then these forums and having gotten excited about this idea, were demanding. So yeah, just keep talking about it, keep working on it, and thanks for spending this time with us to talk about the Minnesota Health Plan.
Thank you, Senator McEwen.
I'll-
Representative Frazier, yeah.
Ann, go ahead.
Hey, there's one more educational opportunity coming up on April 18th. Is it Monday? Yeah, it's called Framing in Action with Senator Marty. And I think George Green, who's on this call, Connections Lab, who's been helping the DFL with messaging. I put the link for that in the chat also. And it's getting better at talking about this stuff, because it is kind of complicated and kind of highly charged, shall we say. And the more you know, the more comfortable you are. It's practice, practice, practice. Anyway, this looks like a good one. I'm going to sign up. So I put that in the chat too, right down at the bottom. Anybody want to say anything, Senator Marty, George, about that?
Yeah, I was going to ask George at the end if he wanted to share anything about that, but this is probably just as good of a time. Thank you, Ann.
Okay.
Go ahead, George, if you want to say a bit about that, and then we'll have Representative Frazier and Marty close out the program for us. Oh, yeah, just a second. There you go, you should be unmuted.
There we go. Yeah, just I've noticed that there are people on here who've been either to our main workshop on framing and messaging, and others. Liz, I believe you've been on a few also. The free webinars that we've been doing since the COVID, and that's and we do those on many issues. This is training for candidates and activists. We focus on local and statewide stuff. We feel this kind of communication based in framing in cognitive science is something that is not, for some reason, embraced at the national level. And so we're just going to do it here because all of us are activists. The best ideas come from us anyway. This is Framing in Action, Healthcare Made Easy. And it'll be one-on-one with the fabulous John Marty, someone I know we all admire. And so I have links for that in the chat. There will also be in that session a Q&A, and that is co-sponsored again like this by the Progressive Caucus and Connections Lab, and it'll be fun. Come on there with your questions, and I think it's going to be a really great time focused on how we message this, how we frame this, and how we message it. Thanks.
Thank you very much, George. Appreciate
Thanks,
it.
George.
Representative Frazier.
Hey, thanks, Rich. Thanks, Ann and George, for that information. And thanks, everybody, for continuing to be engaged. I think the one thing we all know is that Senator Marty started this, and it's been going on a long time. And the reason it stays around is because it is so very important for us to get this done. And what I will say is we'll keep fighting, because nothing worth having, you have to fight for it. If it's worth something, you got to fight for it. And this is something, although we've seen it and we know it's done in other countries and it's done a lot better than we do it here, it's going to be transformational when we do it here. And that's why it's been so hard to get this going and get this in place. But I do feel very hopeful about that. I mean, I talked earlier about why I joined on. A lot of the reasons are the disparities that I see in places and communities like I come from. That's just why this is so important. And in the communities where I came from, we don't have access. And the only time we would go to the hospital is if it was an emergency. And by that time, oftentimes it's too late. I want to see that. I don't want to see that continuing to happen. And Jen was absolutely right. When you're screening those candidates or talking to those candidates, ask them what kind of voice and what kind of advocate they're going to be, what kind of fighter they're going to be. Anyone can get elected and just be a vote, and you can count on that vote. But we need to know that they're going to get in that space, and they're going to be big in that space, and they're going to be fearless in that space, and they're going to continue to push and fight in that space. So I'm ready to keep fighting with you. I'm looking forward to getting out with my colleagues and talking to folks out in the rest of Minnesota to get this moving and get it going. Thank you, everybody.
Thank you very much, Representative Frazier. And Senator Marty, you can close out our program. It's all
Thank you.
yours.
Well, the best thing I can say about this is that I think any of the four chairs, Omar was on with us earlier, Liz Ryer was not, but Liz Bolden and Jen still on, and so on, and then Cedric and I as authors. I'd feel comfortable with any one of those six speaking on this anywhere and feeling they're going to do a great job of doing it. We learn from each other on messaging. That was one of the benefits of the tours we did a number of years ago. By the end of the tour, we were all talking the same kind of language. We learned each other's best stories and lines and so on, and it helps. We really need that. I'm excited about doing some of these tours with folks again. I'm mainly excited to know that there are people who we can trust to. I'm not planning to leave the legislature till we pass this thing, but I'm glad to know there are other people here who can handle it very well and will do it. And then two other points, one of which is winning elections. Liz is jumping to the Senate this year. We desperately need that seat, and we need Alita in the other part of Rochester and Point South. Those are races that I think the more openly we talk about healthcare, the better chance we have of making change. And we need that to happen. And then finally, when the new first term members come there, a lot of them, I think we have a job is this caucus can send out talking points on healthcare. I've done that in the past several election cycles to new candidates saying, you know, here's what the caucus is telling you to talk about. That's good, but maybe you want to also talk about this. And then when we come in, I know 2 years ago, 3 years ago now, we had a whole bunch of new first term House members. I did a training session with them, a lot of them, and one of them, I told them about how the public option would cover 3% of Minnesotans. So if you count all the small businesses and they all signed up, that would be 7% of Minnesotans. He said, you mean I spent the last 6 months talking about a public option that only affects 93% of Minnesotans at max? Yeah, it's not a bad thing. It just kind of disrupts from what we often need to do. So I think we have to, the thing is, it's not one or two people coming in and training them. It's 6 or 7 of us going in and training them. I'm excited about that, but I want to thank the Progressive Caucus and my colleagues here who pulled together this caucus. It's going to make the difference. That and the stuff that Ken mentioned and Ann mentioned about the broader campaign for making this happen. We need it. We're going to make it happen. And I'm excited to be surrounded by wonderful people who care about it deeply too. Thanks.
Thank you all very much. I hope you have a wonderful night. I always like the phrase, take it easy, but take it. Have a good night.